Now, whilst it's cool to be hip, it's not that pleasant having hip pain, especially when it stops you from doing the things that you want to do with the people that you love.
So in this video, we're going to discuss hip osteoarthritis, what you can do to improve your symptoms, and show you some exercises to boost your capacity.
Okay, but we should actually probably take these off. Now, the medical profession used to think of the pain and stiffness associated with hip osteoarthritis as a result of wear and tear, kind of like a car or a bike where it needs oiling and regular replacing of the nuts and bolts. In fact, the opposite is true with our bodies. When it comes to our hips, what we know is that they respond well to loading and exercise, making them more resilient so you can keep doing the things that you want to do.
That's right, and a lot of the findings we see in people with hip osteoarthritis on X-ray and MRIs are normal age-related changes. So things like cartilage thinning and labral tears, we see those in people even without any symptoms at all. So rather than calling it wear and tear, let's call it age-related findings.
So keep in mind that imaging results are not the arbiter of truth. They are not the be-all, end-all. In fact, exercise can actually help with your hip osteoarthritis, even if you are in pain now. The Royal Australian College of General Practitioners put out their most recent guidelines on hip osteoarthritis, and they strongly recommend land-based exercise because what we want to do is make our hip more resilient to load in the long term.
Now, when it comes to land-based exercise or exercise more generally, anything is good for your hips.
Yep.
The best exercise is the one that gets done. But in particular, we think resistance training is a great choice because it helps improve strength, build load tolerance, and of course, confidence in your hip. So let's run through some exercise that you can use to help your hips. Okay, so let's run through 3 resistance exercises that are going to help build strength, confidence, and load tolerance in your hips.
Now, mate, I think it's important to note that you're likely to experience some pain and discomfort whilst doing the exercises, but just keep in mind, this is because we're loading up a sensitive joint in the body. What we're gonna do is show you some little modifications that you can try out to hopefully make the movements more tolerable for you so that you can fit them into your strength workouts.
Okay, great. Now, one of the toughest things for people with hip osteoarthritis and hip pain a lot of the time is simply getting up and out of a chair, okay, or in a squatting type movement. So we're going to prepare you for that by training it, but let's talk about some different variations. Now, the easiest version is starting in a chair like Jack's done there with some cushions to increase the height. Now, this makes it a lot easier than doing it from a low chair. And you can see Jack demonstrating perfectly there. If he needs to, he can hold on with his hands onto the armrests for starters.
Excellent.
Okay, now if that's absolutely no worries and not challenging you, you need to take away the cushions. Okay, so obviously one at a time, we want to go with baby steps.
Yeah, I can already feel that's a little bit lower for me.
A little bit lower, okay, still no symptoms?
Nope.
Great. Okay, so once Jack's comfortable there, we then encourage him to take away another cushion. So he's standing from a chair at a normal height. Once again, good. And just as an aside here, he can experiment with different stance widths to see what feels best for him. So really wide like that, or quite narrow for some people. Either options are fine.
Excellent.
Cool. Once he's mastered that, we're then going to move on to what's called a box squat. So now it takes a lot more control. Rather than sitting down, he's just touching his bottom to the chair and coming back up like so. Now, this is quite a bit more challenging, so you may need to add the cushions back on. And once he's mastered that and he's feeling okay, he can move on to a full squat like so. Now, this variation requires the most amount of control and allows you to get a bit deeper, which is maximizing the benefits.
And you can start with a very small range of motion if you want, just doing shallow squats and then go on to doing deeper squats as you go on.
Yeah, and once you've done that, you can of course gradually increase the weight with some external resistance like a backpack filled with books.
Yep.
Or even a kettlebell or a dumbbell or some gym equipment.
Okay, mate, let's run through the second exercise that you can add in. that's going to be a deadlifting movement, but one that we call the Romanian deadlift. So with a weight such as a bag or a kettlebell, could really be anything you have at home around that size, all you're going to do is hold the weight really close to you and pretend that you're putting that weight down on the ground, but you're not going to go all the way down. So Ollie's going to stick his bottom back as far as he can and let the weight pull him down with a nice proud chest as he's doing it. So just as you can see Ollie doing there from the side, Ollie keeps the kettlebell super close to him and he basically lets his chest come over to the ground while sticking his bottom backwards. Now you will start with a really small range of motion for a lot of people, and then you might increase the range of motion by going a little bit lower, further and further towards the ground. Excellent, just like that. And as you get more and more confident, you can go right to just hovering the weight above the ground as Ollie's doing there. Because we know this movement is often quite hard for people with hip osteoarthritis, so we think this is a great movement to try to work through and get better at. And of course, mate, you can increase the weight to make things harder.
Yeah, for sure. And also don't forget that you can play around with your stance here. So some people will prefer narrower, some people will feel more comfortable with a wider toes out stance to do their Romanian deadlift.
Looks good.
All right, let's move on to exercise number 3. Now, this is a great one that really challenges some of the muscles on the side of the hip. It's called a hip abduction. So you're gonna need something to hold onto for balance. Jack's demonstrating with a stick, but you could use a kitchen bench or a couch, whatever you like. And as you can see, all Jack's doing is taking a straight leg right out to the side, like that. Now, 2 things to make note of. First of all, he tries to keep that foot in the air if he can, but it's no worries if you need to start by putting your foot back down on the ground. Okay. The second thing is that if you can, we want you to keep that toe pointing forwards to really challenge those muscles on the side of the hip.
That's right.
Once again, if you can't manage that and you need to turn your toe out, you're still going to get good benefits.
Yep. And you might just want to start with a small range of motion, see what's tolerable for you, and then as time goes on, you might want to lift your leg out even further.
Yeah, and really make sure that you are controlling it all the way out, then all the way back in. We don't want to see this smacking together of the legs.
No. Now, mate, you can also do these on the ground.
You can. So this is going to make it more challenging. So gravity comes into play a bit more here. All Jack's doing is the same movement, just inside lying. And that's really challenging those hip muscles.
Quite tough, that one.
So once again, you'd start with a very small lift of that leg and then gradually progress to a bigger movement. Of course, doing it on both legs.
Excellent. So there are 3 exercises you can incorporate into your current strength training routine. Alrighty, so you can add these exercises onto your regular training 2 to 3 times per week. We recommend doing 2 to 3 sets of between 8 and 15 repetitions, depending on what challenges you and what is tolerable for you.
Now, when it comes to what you can tolerate, we'd expect that at some point you're probably going to get some hip symptoms when you're starting a new exercise program. But just remember that that pain does not mean that you are causing harm to your hips. You are simply putting some load through a sensitive joint and getting some pain as a response to that. So if you're consistent and patient with the exercises, over time you should start to see your symptoms improve.
Excellent. Well, we hope you enjoyed the video and we really look forward to seeing you in another one.